In this CHSA module, we'll review the general characteristics of the high deductible health plan.
So what is a high deductible health plan? A high deductible health plan must meet the federal guidelines for the floor, the annual deductible, and the ceiling, the out-of-pocket maximum. It must provide certain preventative care services at no cost. And again, high deductible health plan enrollment is a requirement for one to be eligible to contribute to an HSA. If you are familiar with health plans, you may have heard of individual plus one, where it's not really a family plan, it's an individual plus one. There's no such thing with a high deductible health plan. You have if it's more than one person covered under the health plan, it's a family plan. So if it's one person, individual plan, more than one person, it's family plan. This is important because that's going to identify the minimum deductible, the floor, and the out-of-pocket maximum on the ceiling on the plan. In addition, it's also going to dictate how much one can contribute into a HSA associated with that plan. So when it comes to a high deductible health plan, really what's most important to qualify as HSA eligible high deductible health plan is that the floor and ceiling, the floor being the deductible, the ceiling being the out-of-pocket maximum, meets the criteria set by the federal government, and that certain preventative care services be provided at no cost prior to the deductible met. Now, what doesn't matter is the plan design. So you can have a high deductible health plan structured like an HMO, a PPO, or a POS. Now, when we talk about this HMO or the PPO, we're really talking about, do you have to go see a specialist with a referral, or can you go directly with the HMO? You need the referral. With the PPO, you don't. All that doesn't really matter how that plan design is set up. What matters again is the floor and the ceiling. In addition, when it comes to the funding arrangement, an HSA eligible plan can be fully insured, so it's a premium base where the employer is paying a premium to a third party that is providing the insurance, or it could be self-insured where the employer is directly paying all of the claims with the health plan, and they're using that third party as a manager, if you will, to process claims and to get the advantage of their pricing. So that doesn't matter either. So it's important to know what's important and what's not.
So regarding the floor and the ceiling that's set for an HSA eligible high deductible health plan, in 2021, the floor, or the minimum deductible, is $1,400 for an individual plan, $2,800 for a family plan. The ceiling, or the maximum out-of-pocket expense, is $7,000 on the individual plan, $14,000 on the family plan. It's important to note that minimum deductibles do not include preventative services. So preventative care services can be provided prior to that deductible being met and the plan still staying HSA eligible. Minimum deductibles and out-of-pocket maximum expenses also do not include the payment of the premium, services that are not covered under that healthcare plan, and possibly out-of-network services may not be counted against these amounts. But again, this is the framework that the government provides to say this is a plan that is HSA eligible. It's based on this minimum deductible and maximum out-of-pocket expense.
When it comes to expenses associated with a high deductible health plan, preventative care services can be provided at no cost with the high deductible health plan. And there are some preventative care services that must be provided at no cost. So this created a question of whether or not a high deductible health plan would still be a high deductible health plan if services were provided at no cost prior to the deductible being met. In September 2013, the IRS published Notice 2013-57, which addressed this and said basically that the health plan, a high deductible health plan, does not fail to qualify as a high deductible health plan simply because it provides preventative health services without a deductible. So a high deductible health plan is allowed for preventative care services to be provided at no cost prior to the deductible being met by the policyholder. Here is IRS Notice 2004-23, which shows the safe harbor screening services, preventative care services that can be provided through a high deductible health plan at no cost. Many of the items that you would expect to be on such a list. In the summer of 2019, the federal government expanded the list of screening services that can be made available through a high deductible health plan before the deductible at no cost to the individual. We have a list here. The idea was that there were folks with chronic health issues such as asthma, diabetes, heart issues that would not choose a high deductible health plan because they would have to pay too much money out of pocket with that deductible and never be able to build up a balance in a health savings account. So they expanded the screening services so individuals with chronic health issues such as listed would be more likely to be able to take advantage of some of the benefits of the health savings account and the high deductible health plan. Medications can also be considered preventative care and provided at no cost through the high deductible health plan. Basically, the definition of a preventative care prescription drug or medication is it's taken by a person who's developed the risk factors for a disease but not the disease itself, or to prevent reoccurrence of a disease for which a person has recovered. In addition, there are obesity, weight loss, and tobacco cessation programs that are also available as a preventative care prescription drug through that high deductible health plan. So a good example of a person who is taking a medication because they have a risk factor but not the disease would be taking a statin drug because of high cholesterol. And here on the right, we do see an example of some of the preventative care prescription drugs through the CVS Caremark Preventative Therapy Drug List. This is not a exhaustive list by any means, just some of the items that you might be familiar with, some of the prescriptions you might be familiar with.
Let's take a look at the payment structure of a high deductible health plan using the minimum deductible and maximum out-of-pocket expenses for 2021. It's important to note that this is just, again, taking the minimum and maximums that the federal government set up, that floor and the ceiling. Okay, so obviously every plan is going to be different based on how the plan is structured. We're just saying here is the structure provided by the government. We'll use that to take a look at this payment structure. So the first $2,800 is 100% paid by the employee. We'll call the person the employee at this point. So the first $2,800 is paid by the individual or the employee. Now that may not include all expenses because preventative care services can be provided prior to the deductible being met. Now between $2,801 and $14,000, now at that point the health plan is starting to pay claims because that deductible's been met. And again, it's dependent upon the terms of the health plan what the employee is going to be responsible for after the deductible is met. It's going to be co-pays and co-insurance, that percentage of the total cost that the individual has to pay. And again, that'll be based on the health plan. Then at $14,001, at that point, 100% of the claims are paid by the health plan. The employee is not responsible for any of the payments, including co-insurance and co-payments. If you still have questions with regards to this module, please email us at info@accesspointhsa.com.